and welcome to In Touch with Durham County. I'm Deborah Craig Ray, General Manager of Strategic Planning and Innovation. Joining me is our co-host, Wendy Jacobs, Chair of the Board of County Commissioners.
Thank you, Deborah. We use this show to share vital information about the wonderful programs and services provided by Durham County government.
Jovetta Whitfield, Assistant Director of Child and Family Services of the Department of Social Services, will help us understand child welfare reform now underway across our state and what will be happening here in Durham County. In our second segment, we're going to highlight some recent county activities. Chair Jacobs, let's begin our conversation.
Thank you, and thank you, Jovetta, for being with us here today, and thank you for the work that you do every day. Can you tell us a little bit about exactly what you do at the Department of Social Services?
That's a mouthful. As the Assistant Director over Child and Family Services, which encompasses Child Protective Services, investigative assessment, our in-home services and prevention services, our foster care, adoption, and licensing. So it's a huge division that works basically to keep children safe. So I have to oversee that with 3 program managers and probably about 90 to 100 social workers who are on the front line. It also encompasses managing budgets, federal and state funding, to ensure that we have resources that we need to do the work that we're challenged to do, as well as any grants. And we do have a couple of grants that we are involved with, either overseeing or we're partnering with another agency in the community.
Well, you have a lot on your plate. And
along with the day-to-day task of being a substitute parent for children who are in our care.
Mm-hmm. Yeah, well, thank you. You do a great job at what you do and very important work. So can you tell us about child welfare reform that is happening right now in the state and how this all came about?
Yes. So right now there's just been a plan that has been publicized regarding the steps or recommendations for the child welfare reform. So in 2015, the General Assembly passed what most people have heard in the community, House Bill 630. Which was also known as Ryland's Law. And that was in response to a child fatality that happened in another county. So the law sought to both reform child welfare and social services to improve access and services. So it's not just going to impact child welfare, but it will also impact all of social services. But the huge focus is on child welfare. It required a comprehensive study and assessment of the child services and social services to see what the needs were, where the gaps were, and what we can do better to protect children.
So you mentioned Ryland's Law, or just that specific incident. Was there anything else that led to this whole big initiative of child welfare reform?
Yeah, that's just one of them. The state had a Child and Family Services review, and as a result, the state did not pass the review, which is a federal review, and thus there are also recommendations from that. In addition, there was some legislative recommendations to do a study of all 100 counties, and that was program monitoring. And as it is, all the studies had basically the same recommendations. So with that being said, we are moving forth with a reform of child welfare.
Mm-hmm. What are some of the guiding principles coming from this welfare reform effort?
Well, the goal basically is to improve services, accountability, or increase accountability, and improve outcomes for families and children, and most importantly, create consistency across all 100 counties of Department of Social Services. That would be improving practice, policy, training, partnerships, outcome, to create a better system for our staff, but also for our families and children.
Mm-hmm. Mm-hmm. Now, what are some of the big changes that will be coming?
Ooh. Well, the big one is a shift in practice to be more family-centered, but also preventive. Right now, the Department of Social Services is more reactive to when situations happen, and in an effort to meet the needs of families and really protect, the state is looking to shift to a more preventive measure, which will be a huge shift in how our mindset and how we think and how we practice right now. Because that would mean we would have to really involve our families, relatives. They know what they need. They know what can help keep children safe. So we need to involve them more at the table so that we can prevent them from coming into foster care. There are some cases, yes, that need to have our intervention, but there are a lot that children can be maintained in the home. And the reason it's a big shift, not just for DSS, but also for our community partners, is because we will be trying to prevent at all costs children from coming into care. Even if it's those high-risk cases, the trauma that they experience from being removed is probably higher than us bringing them than those keeping them at home, is what I want to say. So you've heard a lot in the community about ACEs, which is the Adverse Childhood Experience, and studies are coming out that children being removed from home is causing an increase to their adverse childhood experience.
Yeah, we can see that.
So with any kind of change, there are challenges. You've referenced some of them. Can you tell us a little bit more about what do you think will be the biggest challenge for Durham County DSS in implementing this child welfare reform?
Again, I think the biggest one is going to be the mind shift, the shift in thinking of how we approach families and children. There hasn't been a change in child welfare and how we approach the work that we do since the early 2000s. And that was when multiple response came out and how we responded on the front end when reports came to us. And it was supposed to be more family-centered, less intrusive. We're not investigators in the sense of law enforcement. We are social workers. So the approach was supposed to be more family-centered, involving the family, not sneaking up on them if it was for, say, neglect. So it's been, 18 years maybe, since there's been any change in practice. And so it's going to be a huge shift for the community. Anyone who makes a report, it's going to be different, because if we're trying to prevent kids from coming into care and how we approach that, I think that's going to be our hugest challenge.
So what is the current status of foster care in Durham?
Durham County has seen a significant increase in kids coming into care over the past 4 to 5 years. Right now we have, as of the end of September, 301 children in care. We have been as high as 310, I believe. We have youth who are aging out of foster care, but are choosing to remain in care. And that's through the new law that came out in 2018, where youth 18 to 21 can sign consent to remain in foster care. And we have 30 youth, or young adults, I should say, who have chosen to remain with us while we can help them to transition to independent living. There are some who are going on to college while they're still in our custody and care. And they're doing good things. There's some who left, but as we do as young adults, leave our own homes, leave the nest, we realize that we need that support. And some have come back and said, I need your help, and we are working with them.
So what are some of the really big changes that are going on right now in the state of North Carolina?
Well, the state is looking at regional offices that will provide the technical support and programmatic support to the counties. And in doing that, it won't just impact child welfare, but it will also be for all of social services. So that's Medicaid, food, nutrition, and adult services. The state is also looking at reliable database. This will allow us to see real-time data on how we are performing in order to meet the needs of children and families, which would be a change because right now our data could be 30 days behind.
Yeah.
So it doesn't give us a real picture of what we are doing and where we are right now, which also will tie into the counties managing for results.
That's right. Very good. So what is the direction in regards to practice?
So the practice will be more family-centered. They're looking at a change theory. Yes, we talk about being family-centered, but the studies have come out to show that we need to be more inclusive of having our relatives at the table, not at the point of intervention, but at the point of prevention. And other stakeholders coming to the table to help us make decisions, to shape practice and policies, maybe internally. We are currently working with the state. We're a pilot county for what we are calling our Family Engagement Committee in child welfare. So we're one of 4 counties that's piloting that. And that means having families who have been involved in child welfare sitting at the table with us, telling us what we might need to do differently to engage our families to have better outcomes, maybe helping us change policy. That's happening on the local level, but it's also happening on the state level where they're getting some of the same training our staff are receiving.
Yeah.
And that's a shift, and that is more family-centered.
Is there like a window that's taking place? Will there be a point where that's kind of done? You take those recommendations and then you put them in place?
Yes, so we are at the beginning stages of planning. We have our charter that was signed in June and approved. So we're at the point now of developing criteria on how we're going to engage families to get them to come to the table to be part of the Family Engagement Committee. We're setting some criteria, so we're in the early stages, but we hope that they will remain on. It won't be something you come on, help us shape policy, because it's ongoing.
Yeah.
So Jovetta, you know, as I'm vice chair of the Social Services Board, so I'm very aware of a lot of what we're talking about and how Durham County is really on the cutting edge. We're very innovative in terms of what's happening in the state. Can you tell our listeners about what are some of the things that Durham County DSS is doing to support families and improve outcomes?
Yes. Well, we work closely with our court system, schools, the Garden ad litem, law enforcement, also our mental health partners, and our medical, Duke, Lincoln, and other partners, whether they're locally or cross county lines. We also work with our big part of the community child protection team. And that is a multidisciplinary approach where you have different partners at the table as well as a community representative who helps us look at some of the systemic issues that might be impacting the safety and well-being of children in Durham County. We also collaborate with some new collaboration out of the program improvement plan from the state. We are piloting that as well on working with our court partners, which is the judges, our parent attorneys, and sitting down at the table again, looking at some of the systemic issues and barriers that are impacting us achieving permanency for children. These are just some of the things we're doing. It's not all inclusive because we are always partnering with families. We can't do this alone. As we often say, protecting children is not a DSS only issue.
Right.
It is a community issue. It is a community expectation, I should say. So partnerships can look professional, lay persons, anyone who might be interested. So we do a lot of that with our faith-based communities as well. We also have the fortunate opportunity to be involved with a grant, which is for domestic violence. We received the grant in 2016. We just received an extension of the grant for 2 additional years. That's $400,000 plus. And that is huge because a lot of our cases that we're receiving involve domestic violence. And we're involved with another partner agency that also has a grant, a federal grant, that is also to help children exit foster care sooner and increase stability while they are in care. So partnership and collaboration is huge, and we couldn't do it without, there's no way possible.
Jovetta, I would like to give you kudos because you in May received the 2018 Distinguished Alumni Award from UNC School of Social Work.
Yes.
So as the outstanding social worker really of the year, so as an alumni. So we really want to recognize that and congratulate you. That's a huge recognition from your peers across the state.
Thank you.
So congratulations.
Very, very proud of you.
Thank you.
Yeah. So we're about out of time. Please tell our viewers how they can get more information about welfare reform.
So the UNC School of Government has a link on their webpage where you can access the report. I believe it's public. It's just phase 1. There are 3 phases to the child welfare reform, and this is just the first phase. The second phase will be implementation of the recommendations, oversight, and monitoring. Then phase 3 will be continued oversight. But the website there will give them that information. If you want to know more information about DSS child welfare, you can go to www.dconc.gov and go to social services, and it will have information about the various programs that we have in the agency, as well as child welfare. If you're interested in becoming a foster parent, you can always call 919-560-8092. That is our recruitment line, and I'm proud to say we appreciate the community stepping up. Our numbers of foster parents has increased. About maybe 2 years ago, we had 52 foster parents. We now have 95 foster parents. So we appreciate the community responding to the need.
Yeah, it's fantastic.
Well, we just appreciate all you do in looking out for our families in Durham County. Thank you so much for joining us.
Thank you for having me.
We're going to take a quick break, and when we come back, we're going to highlight some important events and activities with Durham County government. Stay with us.
When I was in foster care, I never knew when I would have to move, so I always had my suitcase ready to go. Then one day, I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
Welcome back. Durham County has many activities and initiatives that are going on throughout the year, and I thought this might be a great time to emphasize a few of them. Chair Jacobs, you know, within the family, we have moved some offices from one building to another. And then, of course, we've just recently had the ribbon cutting to formally dedicate the building. And then there's another aspect. We're still trying to get a restaurant in here. So talk to us about how important that is.
Right. Well, so this is very exciting. We hope that residents will enjoy coming to the newly renovated Admin 2 building and enjoy the 2 beautiful community meeting rooms that are on the ground floor. And then we are looking for some great local businesses to come in and open restaurants down on the ground floor. We're going to have a wonderful patio area out front with tables and chairs. We want the businesses to be open at night and on the weekends. We really want to activate the space. And we also hope that people just enjoy coming over and, you know, going to the Register of Deeds or going to the tax office or whatever services they need that are now, we have more centralized services located in the Admin 2 building for people. Yeah.
And one good thing about those restaurants when they come, you know, they'll be open, you know, throughout the week and the weekend.
Absolutely.
Really will add a lot
Absolutely.
to downtown.
Absolutely. So I'm very proud of what Durham County is doing to really contribute to the revitalization of downtown Durham and the activation of Main Street.
Yeah, it's really exciting. I've worked here long enough to remember when you'd come downtown, it'd be very quiet, but that is definitely not the case now.
No, and you know, things are moving down East Main Street. So, you know, we are, you know, the Admin 2 building is absolutely beautiful. What we're doing with the transformation at Main, that library building is going to be fantastic. And then moving down East Main Street, we have our Human Services building. We've got the investments the city is making in the new police headquarters, and then we have our 2 parking lot projects on East Main Street that are also exciting.
Now, you mentioned the new police station. I was going to kind of get to that because, you know, we also have a shared service in that building, 911 facility. So talk to us about that a little bit.
Right. So, yeah, we have partnered with the city on the new 911 center, and again, we are going to be really improving our 911 services and the technology that is included. I was speaking to the 911 director and assistant director actually recently, and they told me about we are going to be the first in the state that has the ability to integrate different formats with you know, emergency services to communicate with other counties. So we're really investing in important services for people in our community.
Yes, it's a great time.
Yeah.
And the other new function, if you will, that we have going on is really sort of, again, a joint function, Fire Station 17
Yes.
and EMS co-located. Talk about that a little bit.
Absolutely. So we just had the ribbon cutting for that event, which is a great collaboration with the city fire department, and we've also just merged a lot of the city and county fire department services, again, to better be more efficient and deliver better services to our residents. But this is out on Leesville Road, and we realized that we had some residents coming to us and urging us to provide better EMS services in that part of the county, which is right near the border with Wake County, off of 70. And I really thank the residents of Carolina Arbors and that community for really making us aware of an unmet need. And so we realized that there was an opportunity to partner with the city and with Pulte Homes. The developer donated the land, so it's a great public-private partnership, and hopefully a model for what we can do in other places in Durham County. And so basically you've got the fire station on one side and EMS on the other, and you've got the facilities for all of the firefighters on one side, and they have, you know, places to sleep and things like that, nice kitchen. And then on the other side we've got an area for our EMS staff to be able to rest or study and do work when they can take a break. And it's saved money, and it also brings the services directly to the people of that community that really need it. So it's a great partnership.
Yeah, I think it's wonderful timing if you consider, you know, how many people are moving into our county and city, and you know, the ability to respond well is critical to keep us a very good and highly respected community. So it's really exciting.
Right, absolutely. And you know, I appreciate the involvement of the residents. We need to hear from our residents. We don't always know that there's an urgent need, and appreciate that we have residents that are very engaged in our community. And I know they will be supporting that fire station.
Oh yes, yes. We've already seen evidence of that.
Yes.
Now the other thing that's going to go on is, because we've had some departments move out of the main administration building into the new one, there'll be some changes in the current administration building. Can you talk about that?
Right. Well, we have had a lot of our department staff working on different floors, people not actually having offices, being in little cubicles. We've been very overcrowded in a lot of departments, and so for the first time we will be able to have our attorneys on the same floor, budget office will be on the same floor, members of the county manager's office on the same floor. And so again, it's going to really help our Durham County staff to be able to do their work and so that we can better serve residents in our community. So that's another exciting project that's happening.
Yeah.
And actually, even the county commissioners, we all share offices.
Right.
And so it'll be nice for us to even have an office where we can do our work and also meet with residents.
Yes, I'm sure that'll be a good thing.
Yes.
Just to have a little space to yourselves.
Right. And then there's going to be an innovation center. The city has a great innovation lab, and we're doing a lot of the same things in the county, and that's something new that we're going to have in that building. Yeah.
Well, one other thing that we do mutually with the city that we talked about those things that we do together, emergency management. So, of course, earlier this year we had Hurricane Florence come through and near, and I know you and the mayor actually sat down
Yes, we
together
did.
and talked about what needed to be done to help the community plan to respond.
Right,
So, what was
right.
that like, and how do you think we did as a community working together?
Right. Well, I think it was a great response. I really want to applaud everybody who is a part of the Emergency Operation Center. They were very active on Facebook, social media, keeping everyone informed almost on a daily basis. But it's the collaboration, the partnership. We've got all the first responders are there, Durham Public Schools, city and county staff, and everybody is working together as best we can. General services, public works, and even Go Triangle. We had Go Triangle staff over at the EOC so that we can all be communicating and collaborating. And we were very fortunate with Hurricane Florence, and I think it kind of gave us a test run. We operated a shelter. That DSS staff operated, and then we had the Rougemont community also, and the Bahama community helping us with a shelter out there that they operated on their own. So it really, we've learned a lot of lessons. A lot of people signed up for Alert Durham, and we need everyone to sign up for Alert Durham. But we're going to be in better shape for next time, because we know there will be a next time.
Absolutely, there
Yeah.
always is. There
Yes.
always is. Now, one other thing that's really big in this area is conversations around transit. We've got a
Yes.
lot going on around transit. Talk about that a little bit.
So I'm on the Go Triangle board. I'm also vice chair of our local metropolitan planning organization, our regional planning group. So I'm very involved with transportation. But the Durham Orange Light Rail project is really going to be a transformative project for our region. And then that feeds into just the whole vision of commuter rail with Wake County, bus rapid transit happening in Chapel Hill and Wake County. And so we're creating a regional transit system. And we have to. If we want to provide for the needs of our residents and also compete with other communities, find places for 1 million people coming to our region to work and live. So the Durham Orange Light Rail is, we've 18 station areas, almost 18 miles, connecting UNC, Chapel Hill, then downtown Durham and Duke and the VA hospital, coming over to North Carolina Central University, connecting 3 of the 10 biggest employers in the state, and also made 3 big hospitals and 3 great universities, Duke, UNC, and Chapel Hill. And most people ride transit for work and for education, and that's exactly what we're connecting with this project.
Fantastic.
Yeah.
Well, we've had a very good conversation. I appreciate you kind of switching hats a little bit and just kind of helping our residents get on top of some of the big things that Durham County government is doing right now.
Well, it's an exciting time. So lots happening, and I appreciate the opportunity to have this conversation.
We're going to
with
have to
you.
do this again.
Absolutely.
All right. Well, we want to thank you so much for joining us. We've had a great day today, and we will come back very soon with a new edition of In Touch with Durham County. Cheers.